Hey guys, Dr. J here. Today we're going to talk about how to address chronic shoulder pain. We're going to dive into this topic. And before we do, please smash that like button. Love to see your comments down below. All right, so when we dive in, we look at functional medicine topics. Functional medicine is all about dealing with the root underlying cause. Now, a lot of times we're dealing with hormones and gut issues, and that's looking at biochemistry, diet, lifestyle, all plays a big role. But when we have chronic joint, tendon, soft tissue issues, right, what do? How do we address it? So, of course, anti-inflammatory diets, good omega-3s, good anti-inflammatory herbs like boswellia, curcumin, ginger, white willow bark, things that can really help reduce inflammation. We can also do proteolytic enzymes taken away from food that can really help with tissue pliability and inflammation. One of the big things I love is a massage gun, a percussor. So I'll put the link for this one. This is the Bob and Brad's. I have the Bob and Brad's and the Theragun. They're both really good. Favorite why I like this one is 16 millimeter amplitude. So very good. You have different heads here. This is a good head because you can kind of flush the tissue like this and kind of break up a tissue due to that, almost like that soft kind of wedge. You can really just kind of iron out some of the soft tissue issues, if you will. You can also do a softer kind of dampener head as well, which is nice, and you can change the angle. So if you're hitting it like this, you may want to change it like that. If you're coming up on the shoulder, you could do it more at a 45-degree angle, so you can change the head. So 16 millimeter, and then you got about a 30 hertz frequency. This goes about 2,500 hertz, and that's a minute. So if you do 2,500 divided by 60, so it's about 41.6 hertz. So in that 30 to 50 hertz frequency is a very powerful therapeutic healing frequency. So first thing we're going to do is put the massage gun on. You can start it on a little bit lower. 1,500 is fine. That's divided by 60. It's about 25 hertz. And so you can start what I call it mowing the lawn. So if I'm doing my shoulder, I always like to do the tissue or the area above and below. So the first thing I'll do is I'll start doing the whole entire bicep. So I call it mowing the lawn. So you can do little small circles up the tissue to the shoulder and then right back down. I'll put the link down below where you can get the massage percussors as well. Again, the Theragun and the Bob and Brad's D6 tend to be the ones that are the most therapeutic in regards to amplitude. That's 16 millimeters. I'll put the link in the description and a pinned comment. So now I'm coming back up, and I like doing you can go just straight up. I'll go up with semicircles. So I'll do little circles on the way up. And what I do is, I call this mowing the lawn. I'm just making note of his tender spots, areas of tenderness, and I may spend a little bit more time over that tender area and let it melt a little bit if I feel it. So first off, do the shoulder. I'm going to go up now. So you can start off a little bit lower and then work your way out. And so I'll do these little small semicircles like this, come all the way up. You got a bicep tendon right here. They'll call it the bicipital groove. So I'll maybe go up and down. So here's the tendon or the groove. I'll put this right in alignment with it so I can get in that groove. And I'll go up and down on it just like this. Just little semicircles. And then I'll work it back down again. So semicircle back down. Come back up over here. Same thing. Little semicircle. So I'll do this for about a minute or two to start. And I'll try to pass this elbow joint. I want to make sure when there's pain, the pain may not just be emanating from that area. Maybe from the instability or in that tightness in the tendon from the distal end, right? Proximal means closer to the shoulder. It could be distal end tendon issues. Or it could be in the muscle belly as well. So I want to hit the whole entire area because the muscle could be so tight, it's pulling on the tendon up here, causing inflammation, but the tightness could be down below. So I always want to hit the whole entire tissue like that. So I'll do my small little circles up and down. Okay, now I can also do the armpit too. Get right in the armpit, get the subscap going. Just up and down right here. You may get a little tingles in your fingers too. All right, now is my myofascial release. So now I'm gonna do 4 planes of motion for my myofascial release. Plane 1 is just a push-up motion. So essentially I'm shortening, putting it on that area, and lengthening. So I'm putting it right into that tissue and lengthening. Putting it right into the tissue while it's short and lengthen. So shorten, lengthen, shorten, lengthen, shorten, lengthen, shorten, lengthen. And I may change the angles too. So I'm do more of an incline, about 4 or 5 passes, more of a decline. I'm gonna get into the pec minor a little bit. So here, pec minor. And then now I'm going to reach over, and now I'm going to do adduction, abduction. So adduction to the midline, abduction away. So I call these either the swims, or this is like your snow angel. And then now you have flexion, extension. Flexion, extension. Flexion, extension. And then I'll also do a rotator cuff. So I'll come in here like this. Now this is just a rotation, external, internal rotation of the shoulder, doing the subscap. And now I'm gonna hit the bicep tendon while I do it as well. So if you're doing throwing mode, I do a lot of throwing stuff with my kids, playing baseball, catch, pitching my kid batting practice. So let's get that tendon nice and loose. Okay. All right, so that's so step 1, mowing the lawn. Step 2, myofascial release of that area, right? Shorten, lengthen, here are the motions. Forward, so push, pull, right? Push, pull, abduction, or I should say adduction, abduction, right? Adduction, ab, ab, flexion, extension, and then what was the other one? And then I'll do internal rotation of the shoulder. And those are the big 4, the big 5 right there. This motion, this motion, this motion, this motion, this motion. So 5. And then the next thing is now it's a good time to stretch. And so this is where I'll come in here like this. First motion I'll do is this. I'll come right here like this, and I'll lean in right here, and I'll do a nice stretch, just like this. About 20 seconds. Now I'll grab it lower. About 20 seconds. And now I'm going to do a hang. So I'm trying to stretch all planes of the muscle. The high, in a high position, in a medium position, and in a low position. And one thing I'll do in the last 5 seconds, so in the 20-second hold, the last 5, I'll do a PNF, proprioceptive neurofacilitation, where I'll actually shorten the muscle. Now I'm pushing into this for 5 seconds. 4, 3, 2, 1, and then I relax. And so it's called contract, relax, antagonistic. So you're getting, if I'm stretching this muscle, I'm trying to activate essentially that muscle, which then allows the other muscle to shorten. So my biceps like this, right? And I want to, let's say, stretch my tricep. By doing this motion, this muscle over here has to essentially turn off. And so it turns off the opposing muscle so you can get relaxation there. Hope that makes sense. Any questions, let me know. That's kind of my protocol. You can apply this to a lot of other areas of the body, which is really cool. Back as well, I can do a whole other video on how to deal with lower back stuff. So kind of recap, work above and below the joint all the way up, semicircular movements, mowing the lawn, make note of where there's a lot of pain. Work on the tendons on the outside. This is your medial epicondylitis. This is your tennis elbow, or the outside. This is your golfer's elbow, right? Your lateral epicondylitis. And then get into your armpit a little bit. Do that first for a minute or two. And the next thing is do your push-pull up and down, or your lat pull down, your adduction, abduction, your flexion, extension, and your internal, external rotation. Then you hit all ranges of motion, and that gives you a pretty good, healthy foundation. All right, guys, I see patients all over the world on the functional medicine side. If you want to dive in deeper, you want more support, let me know. I'm here to help. Link down in the description and the pinned comment down below for products and ways to reach out to me, myself, Dr. J. All right, guys, hope you enjoyed today's video. If you did, please let me know. Take care, guys.